How's it going, everyone? I'm Nader Yassin, Doctor of Physical Therapy student at University of the Pacific, here at Balance Physical Therapy. So, do you guys ever have back pain or hip pain waking up in the middle of the night, getting up out of bed? We're going to show you some positioning that you can do while you're sleeping or right before you fall asleep to kind of assist you, okay? So I have Kurt Munoz, Doctor of Physical Therapy here at Balance Physical Therapy. So first thing we're going to do is have him just lay down on your side, or yeah, on your back, perfect. So first thing we can do is make sure that his pelvis is not going to be posterior pelvic tilting or anterior pelvic tilting. So if you can see the kind of an arch to the back right here, what we're going to do is we're going to put some pillows underneath his legs right here. So as you guys can see, this kind of posteriorly tilts his pelvis to reduce the amount of stress on his back. So this is a good one for the back sleepers. Let's try to show you guys something for the side sleepers. So let's lie on your side, please. So that will reduce pain on the back. Now we're gonna try to reduce some pain on the hip. So if Kurt was to have his knee fall in, do you guys see how there's a lot of strain on the hip right here? So we're gonna try to reduce that. Kurt, go ahead and put your knees on top of the pillows. So right here, this prevents his knees from going into adduction or going across the midline. So as you guys can see right here, he's pretty much perfectly lined up with his posture and everything. So this is a good one for the side sleepers. Kurt, let's try to have you lay on your stomach. Perfect. No, you're good. All right, so for the belly sleepers, we can have a pillow underneath their head if they like. So let's get that pillow. And then if they like, they can also put one underneath their stomach. So again, this prevents the pelvis going into an anterior pelvic tilt, which reduces the amount of stress on the low back. And then getting up out of bed, go ahead, Kurt. So Kurt, lay on your side for me. So this is a real good way to get out of bed to prevent future injuries or prevent pain. So just like Kurt's laying right here, what we're gonna do is we're gonna let his knees come forward. His feet are gonna fall forward. He's gonna push himself off and then lift himself up. So this reduces the amount of strain and stress placed on the low back, and this makes it easier to stand up. Thanks for chiming in, guys. Make sure you follow us on balancept.com to follow our blogs, and then if you wanna follow us on Instagram, it's balanceptmove.